Hi, good morning, everybody. Today, oh my gosh, I gotta tell you, I've been through a whirlwind. Sorry that I look like this, but I just woke up. It's 6 o'clock in the morning. I just washed my face and blah, 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 whatever. Supposed to be, by my last menstrual period, 6 weeks pregnant today, which means the fetal age of development is only 4 weeks. I don't understand this crap, and I don't understand why they go by your last menstrual period when you weren't even pregnant for like that week or the week after your period. So basically for 2 weeks. So anyway, I don't understand it, but okay, here's my dilemma. Today's the 21st of November, Thursday. Last Friday, after my clinicals at the hospital, because I'm a nursing student, I'm in second semester, I went home and I noticed early on that I had started having spotting, like pink, only pink. There was no red, there was no clots, there was nothing that was alarming or devastating, just pink, which I didn't have with my son 16 years ago because I have a 16-year-old son. And so I was just like monitoring it, and I started wearing a thin panty liner just to see if anything was going to collect, and nothing collected. It only happened after I went to the bathroom to pee, and then I would go to wipe, and then there would be a little bit of pink. So it happened Friday, Saturday, Sunday. And Friday, because I was alarmed, like I wasn't alarmed, but I didn't know what was going on, and I didn't have a doctor's OB appointment until the first week of December to be seen by anyone. So I made an appointment with my primary care doctor, not only to confirm the pregnancy, but because I had the 2 home pregnancy tests, clear blue, but to also, find out what's the spotting, because I'm Rh negative, O negative blood type. So there's some consequences that can go on there with my blood mixing with the baby's blood, because my boyfriend is O positive and things like that. So I went Monday to my primary care doctor, and get this, sorry, they had me pee in a cup. My boyfriend's there, my mom's there. The doctor walks in and says, we did 2 pregnancy dipsticks and they both came back negative. Yes, he said negative. He said out of 4 of my staff members, all 3 of us did not see a line, and only one of them saw a possible faint line showing pregnancy. And I'm like, okay. So I showed him pictures of my 2 pregnancy tests, clear blue. One was digital that said pregnant. One was the other, that goes through the window. And I was like, I'm definitely pregnant. I mean, my boobs are huge and swollen, and I'm like, anyway, so I told him, I said, well, I'm definitely pregnant. I don't know what's wrong with your sticks. On top of that, I'm Rh negative and I've been spotting. So what do you suggest I do? And he said, well, because you had 2 pregnancy tests that were positive at home, you're Rh negative and you're bleeding, I would suggest that you go to the emergency room, because I might need the Rogam shot. The Rogam shot is to protect the baby in case my blood tries to attack and kill the baby. So I ended up going to the ER. They made me do another urine test and drew blood. They put an IV in me and gave me fluids. And my urine came back positive. I am pregnant. Freaking have the paperwork right here. It's like, it's so absurd. I just don't even. So I'm going to show you here the paperwork. I don't know if you can see it there, but it says HCG urine qualitative positive. And then it says above that HCG beta quant 478.80, which means that's my HCG count. Hold on, I want to make sure that you can see this. Let me move my finger, and I want to make sure you're seeing what I'm seeing. Hopefully you can see it. Hopefully it's not being blurry. I have a feeling it might be being blurry, so I'm going to pull out a little bit. And anyway, so positive, right, at the emergency room. So I'm like, oh, great. So my doctor's office just fucking scared the hell out of me. Pardon my French. They have some whacked out pregnancy tests that are trying to give freaking pregnant women heart attacks or making them feel like they're crazy because they come back and say, our test is negative. Okay, so just totally freaking like I was in the freaking Twilight Zone, okay? I can't even tell you. Like, my hormones are raging and stuff. I don't know if my being pregnant is giving me Tourette syndrome, but I've started cussing a lot and I have very low patience. I don't know if you guys are feeling that, but my hormones are like raging. They're all over the place. So then on top of that, they have this girl, Katie, give me a transvaginal ultrasound in a storage room at the hospital because all the rooms were full, so they didn't want me to have to wait. So she pushes me in a wheelchair into the storage room where she has the bed and the little ultrasound set up. And then she tells me, oh, your bladder's full, after she sticks the thing in me and says, we need you to go empty your bladder. So it's just me and her, so I don't know why she said we. So I go and I empty my bladder and I come back, and then she sticks the vaginal probe in me again and says, wow, your bladder's filling up again already. And I'm like, I just emptied my bladder. How can my bladder be filling up that fast? It's kind of weird. But anyway, on the ultrasound report, she put findings. Intrauterine gestation. No intrauterine gestation is visualized. Then, normally you could see the ovaries. Anybody who's an ultrasound tech can find a woman's ovaries because you have to check them for cysts and abnormalities and cancer and growths and this and that. You have to measure them. So on my report, she wrote, right ovary, not visualized due to bowel gas. Left ovary, not visualized due to bowel gas. So I'm thinking, this girl was hardly in my vajayjay. I mean, literally less than 3 minutes. And she reported back that she couldn't see my ovaries due to this, and that she couldn't see. Anyway, I'm just so upset because I feel like she was very inexperienced. Then it says, pregnancy of unknown location. No intrauterine gestational sac visualized. In the setting of a positive pregnancy test, which is what I had, and it was confirmed with the emergency room through blood and urine, considerations include early intrauterine gestation, which means I was just too early for it to be anything to be seen, early ectopic gestation, and spontaneous abortion. Recommended correlation with quantitative beta HCG, which means do a follow-up HCG in 2 days, and follow-up ultrasound as appropriate. So that's what it says here from the hospital. So I called my OBGYN that's not my OBGYN yet, because all I did was make an appointment with them and haven't been seen by them yet. So sorry, I have to clean that because it was getting blurry. So I talked to the triage nurse on the phone. I told her everything that happened, and thank God she's on the 4th floor of that same hospital that I went to, the ER, so she could access all my records from the ER on Monday. I called her yesterday, Wednesday, and told her everything that happened. She suggested that I go back to the lab to have my blood drawn again, and she sent an order down for another HCG. She basically said, we want your numbers to go up. If they go up, that's a good sign. If they go down, it's a bad sign that you're probably having a miscarriage. So I went and I got my blood drawn, and I waited about an hour, and I called her office. Of course, they were closed. Yeah, they were closed, because she told me I could call her back to get the results yesterday. And yeah, they were closed. I'm not even going to tell you about what happened with the lady who drew my blood. Okay, I am going to tell you, so let me rewind. Hold on. So I go in there to have my blood drawn. She pulls out this. First of all, I have really good veins. You can see here, this is what the biddy did to me. Yes, I called her a biddy. I have huge veins, okay? Huge. So when people have huge veins, you don't necessarily have to use a 21 gauge needle, because those are the biggest needles. you don't have to, because they're so big. You just don't. And if a patient's preference is for a small needle, you do a small needle. So she pulls out this 21 gauge needle, and I said, can you use a smaller needle than that? And she said, this is a small needle. And I looked at her and I said, ma'am, I used to be a phlebotomist. I know that that's a 21 gauge needle. And I know that you have 23s and 25 butterflies in there. And I prefer a small needle. And she looked at me right in my face and lied to me and said, we don't have any smaller ones. This is the smallest we have. So you're telling me all those little old ladies, all those dialysis patients, all the little kids that come in there, you don't have no butterflies and no 23 or 25 gauge needles that you can use on a smaller needle. She flat out lied to me in my face, okay? Anyway, that's a whole nother story. I'm trying to pray and have God get me patience regarding that. She basically gave me a hematoma. A big, huge vein. And she gave me a hematoma. So anyway, karma, lady, karma. Yeah, that's right. That's why you're staying a vampire and I'm on my way to be an RN. Anyway, so I called the triage nurse in OB, and of course they're closed. So what do? I'm like freaking out going, why did she tell me to call her back today? I could get the results. And they're closed an hour later. I'm like, that's pretty fucked up. So anyway, my brain kicked in and I said, I'm gonna go sign on to the hospital patient portal, and I'm going to create my own account and see if I can have access to my own records. So sure enough, I had access to my own records, and it showed labs that were done today with today's date on it. So I clicked on it. My freaking HCG level was there. And guess what, guys? It went up 620. My first HCG went from the ER on Monday was 478.80. 2 days later on Wednesday, I went yesterday and had it drawn again, and it's 620.2, I think. 620.2. So my HCG levels are going up. I am not having any pain in my pelvic area. My spotting stopped, the little pink. And when I say pink, it wasn't even going on the pad that I've been wearing for 3 days, Friday, Saturday, and Sunday. It was only when I wiped. So that could be because the cervix is softening and it's sensitive and making more red blood cells and blah, blah, blah. So I haven't had any bleeding, no spotting, no cramping. My boobs are heavy and huge. I'm having brain fog. I freaking took a test yesterday, some sort of assessment level test to see. It's like a base, like a standard base, knowledge base test. Sorry, see, there's that brain fog. And you're supposed to, it's really good if you get a level 2 or a level 3, and because it shows proficiency in nursing. And so it was 130 questions. It took 130 minutes. So you had a minute for each question. And I wasn't feeling it yesterday because I just went to the emergency room on Monday. Here it's Wednesday. Okay, so I went to the emergency room on Monday, went through all that crap where I was told I wasn't pregnant by my primary care doctor, go to the ER to find out that I am pregnant, then also go to the ER to find out in the ultrasound they can't see no baby, and they're saying pregnancy of unknown location. Oh my God. Oh, and I forgot to tell you, I did have to get the Rogam shot. They ended up giving me the shot in the butt because I was having the spotting, so they can't let your blood mix. So I forgot to tell you that. And then on top of that, I had a fucking, excuse my French again, huge mother baby test the next day, Tuesday. It was my last exam before the final, which I love mother baby class anyway. That's like my favorite class. I want to work in postpartum. And I made a 92. So I did really well. I was like really happy after all that stress. But then Wednesday morning at 8 o'clock the next morning, I had that knowledge-based assessment test, and I scored a level 1, but that was because I wasn't feeling it. I just wasn't feeling it. You didn't get a grade for it. It didn't go towards anything. It was just to see where you are, and I guess we saw where I was. I wasn't feeling it. I was not feeling it. I was so stressed out about everything. So, and I had reason to be. So I was 1 point away from a level 2. I got a 67. You needed a 68 to be a level 2. So I'm like, whatevs. I'm fine. I wasn't feeling it. Wasn't even reading the questions all the way, kind of, gotta be honest. So anyway, that's my 5-week trilogy of what happened during my supposed 5 weeks of being gestational pregnant for my last menstrual period. It was 5 weeks, and went on a freaking roller coaster ride of being told I'm not pregnant, to being told I'm pregnant, to being told that pregnancy of unknown location. So I don't know what the hell to do. I'm going to have my HCG drawn again on Friday. I'll let you guys know if my numbers go up. I still don't have an OB appointment yet to actually see a doctor. I'll let you guys know when I have that. They did make an appointment for me on Monday, 11:25, to fill out paperwork, but they said I'm not going to see a doctor. She said we have to do a health history and take all my document. Then they'll make me an appointment to see a doctor at that point on Monday. So I'm just going to have to go from there. I mean, I definitely still feel pregnant. I know I've been watching a lot of videos about if you still feel pregnant, that's good. I mean, I'm definitely pregnant. I don't understand. I mean, all these people are trying to scare me just because I'm 44 years old. And I'm in the best shape of my life. I mean, I really am. I'm in great freaking shape. I don't know if you can see me, but I'm in great shape. Like, I was going to the gym, and I was, like, doing 250 sit-ups every day, crunches, because, I'm a core person. I love to have a strong core. But anyways, so I just wanted to fill you in. Thanks for watching. Also, if you guys have any HCG numbers that you want to tell me where they should be. I mean, supposedly I'm 6 weeks pregnant and my HCG is only at 620.2. I read that they can't even see a baby sac on the ultrasound unless you're 1200 HCG or more. So I'm not even there yet. So I feel like it's too early to see the baby. Let me know what you guys think, because of course this is like worrying me. So if you guys have any advice, please let me know. But like I said, my boobs are huge and heavy and painful, and my mood, my hormones are all over the place. So I definitely still feel pregnant. So that's a good thing. All right, thank you so much for watching. Stay tuned. I'll let you know on Friday what my third HCG levels are. All right, bye.